Hi, everyone. I'm Karen Howard, the moderator of this next session entitled MHA Report Findings, the Urgent Need for More Education, Services, and Supports. We really appreciate you all tuning in and continuing to participate in this policy meeting. And we are especially proud of the work of this next panel and the authors that are joining us. We have with us today MHA's Executive Vice President of Public Policy, Mary Giliberti, MHA's Program Associate, Sydney Daniello, and MHA's Policy Intern, Ethan Burrell, who is with us this summer and has been a great contributor to the report, especially thanks to the Jeanette K. Watson Fellowship, which is helping to support his internship with MHA this summer. As you all know, lived experience is really at the heart of all that Mental Health America does. And we really thought that producing this report was important for policymakers, decision makers, individuals and families, as well as organizations, because our MHA screening data from across the country is showing clear trends in our youth. And the data, as you heard from Teresa earlier, is warranting a response. So let's hear from Mary, Sid, and Ethan about the report that was released on July 20th and how we can set up a framework for going forward to meet young people where they are in schools.
So the report is the youth mental health crisis, the urgent need for more education services and supports. And addressing the youth mental health crisis is the exact reason why we did the report. And the report focuses quite a bit on state initiatives because they are the laboratory for change, as we all know. And so we can look at what's working. And we hope that the folks reading this report will be able to use this information to move forward in their own states and also nationally. We'll talk about those recommendations. So who is this information for? Who will we be targeting with this report? Target audience includes, of course, state policymakers, because we're looking at state policies, advocates, folks out there who want to make a change, youth, and you're going to be hearing how youth leaders have pushed so many of these policies forward. Their voice has made an incredible difference. So they are certainly an important audience for this report. Families, administrators, mental health professionals, and educators. In several states, educators have really pushed these policies forward because they see the difference in the school system when we have education and treatment and services.
So as we've heard so far, the youth mental health trends are troubling and access to care is limited. Rates of young people experiencing depression doubled over the last decade. And as you can see, the percentage of youth who report experiencing a past year major depressive episode has steadily risen over the last 10 years since 2009. And as you've already heard from our colleague Teresa, COVID-19 has only worsened that. It's thrown fuel on the fire and exacerbated these alarming trends. So the report we put out on July 20th addresses some of the key ways that we can use school-based mental health policy to meet young people where they are and address these issues. The report highlights states such as New York, Virginia, Oregon, and other states that have been leaders in establishing legislation aimed at improving youth mental health in schools. Mental health education was one of the topics that we covered most extensively in the report, as it's proven to be an effective intervention for improving youth mental health. States that mandate more mental health policies have significantly lower adolescent and youth adult suicide and substance abuse rates. State mandated school-based mental health centers, social emotional curriculum, and school professional development and suicide prevention are all associated with much lower adolescent and youth suicide and substance abuse rates. So some of our recommendations for this topic area include building on what exists and being vigilant with implementation. So some states like New York and Virginia have statutes, while others have regulations or other structures in place that definitely need to be built on and improved. The report includes several state-by-state charts where you can see where your state is, see what exists in the state already, and see what you can add to what's already there. New York is an excellent example of a state that was able to both build onto existing policy structures and create a resource center to help with the timely and successful implementation of new legislation in the state. A two-word addition to existing legislation regarding health education was what allowed the expansion of K-12 health education requirements in the state to include instruction on mental health. So you can see that legislation here, and that two-word change was one of the most significant bills that we focused on in our report. So in 2018, our affiliate, the Mental Health Association in New York State, was able to secure legislative funding to create a school mental health resource and training center to help schools successfully implement the new mental health law, the new mental health education law. Resources from the center were created and made available to all New York State public schools and private schools at no cost. The center and the sources they provided played an important role in the effective implementation of the law by helping schools to develop their mental health education curricula in time for the fall semester. Interest from the school communities, including families and school personnel, as well as teachers and other community members, has been very high so far, with over 88% of school communities contacting the resource center.
And now we're going to talk about the second section of the report, which was about school-based services. And this was a very extensive section of the report with lots of recommendations. The slides will be available to you after, and of course the report itself has all these examples detailed. So with respect to Medicaid, we often say no money, no mission, right? So you need that sustainable financing. And earlier, CMS, the Centers for Medicaid and Medicare Services, said that you can use Medicaid beyond the services that are in what we know as an IEP, an individualized education plan. Those plans are only for students with some of the most significant disabilities, including in the mental health area. So lots of students get help who don't have that IEP. And CMS said you can use Medicaid beyond those plans. And only 14 states to date have taken advantage of that. And you can see that on the chart. And so it's really important that advocates in other states get that financing in place. And we detail in the report the story of Michigan, and we cite to some additional fact sheets done by other organizations that you can use to really understand and move that forward in your own state. Telehealth, we all know during COVID-19, massive use of telehealth, right? And states have chosen to make it really clear that Medicaid will pay for telehealth in schools, but only about half the states have done that. And then some states have really gone above and beyond and really well developed their telehealth mental health program. And Texas is a wonderful example of that. They provide extensive mental health services for students across the state, reaching areas that don't have the needed providers and getting to students quickly and connecting them up with local resources. Ratios. So we know that mental health services can get provided in the schools by school-based mental health providers and by community providers. The ratio issue is school-based mental health professionals. How many do we have per how many students? It's been proven that states that have ratios in statute do better at having more mental health professionals per student, and that makes a big difference. What we found is our youth talked about how they had found that their counselors weren't always available to them because they were so busy doing career counseling, college counseling, administrative work, and not helping them with their mental health issues. So ratios are very important. We highlight a few states there that have been working on that issue. Services at the schools by community mental health providers. And this is one of the most impactful policy recommendations that we have in our report. This is how states have brought community providers right to the school site, so students don't experience all those barriers. And this has been particularly helpful in reaching students of color, because you're eliminating all those barriers to care, and they are, as a group, more likely to only receive their services at school. So our advocacy recommendations here are twofold. First, to seek sustainable funding for community mental health providers, funding that they can continue to get, not just one-time grant funding, and design programs that increase access to mental health care and address inequity.
So the next section we'll talk about is excused absences and youth empowerment. So young people care about the excused absences for mental health. Just like a regular sick physical day, so you have a fever, it's also imperative that students are allowed to take a mental health sick day. Such as Oregon HB 1291, a group of students such as Haley Hardcastle and Derek Evans, they actually advocated for students to get a mental health sick day within the state of Oregon. It's imperative that we also empower youth leadership and involvement, as we have to empower, really, showcase the voices of all young people, make sure they can be heard throughout the United States. So it's imperative that the legislators, advocacy groups really try to incorporate the voices of young people, because at the end of the day, they are the target group that we're looking for to really allow them to have a good mental health in order to pursue their education in the future.
So resources in the report. Let's talk about what you can use that we put together there. There are state charts. So every topic that we've discussed today, there are charts that show you your state and what's going on in the state. So you can take a look, see what you have and what you might still need. Fact sheets and an infographic to make the case to policymakers. We've talked a lot about all the data, but this is a clear, crisp way that you can just hand these one-pagers off to legislators. It would be great if you can add some facts from your own local community or your state to supplement what we've provided on a national basis. And then the playbook. The playbook is a really simple way of looking at what happened in New York, what the things that they did to overcome resistance. And it's a quick way to get the information that you can share with other advocates and talk through the playbook and how you're going to approach this in your state. And then, of course, the full report, which has a lot of detailed information, much more examples and details and facts than we could possibly present today. So we look forward to helping anyone out there who's working on these issues. We're here to support our affiliates and others who are working to advance youth mental health in schools. And we hope that you will make good use of all of these resources and materials.
So thank you so much for that wonderful overview of the school-based mental health services, supports, and education report, Mary, Sid, and Ethan. I'd love to have a conversation with you, and feel free to hop in where you feel most ready to answer, but we did have a list of prepared questions, and we actually have 15 to 20 minutes to discuss, so we can go into a little bit of detail. I'll start with you, Sid, and then open it up. Sydney, the report highlights a lot of screening data that you covered just now, and that Teresa covered as well in her earlier presentation, including the steady increases in the reporting of and severity of anxiety, depression, and suicidality in youth, as well as the disparities that are apparent between Black and Hispanic or Latinx youth in receiving treatment and white youth receiving treatment. Appendix A and B of the report, which are printable resources that you guys made available to advocates and policymakers, show even more trends and particular facts in MHA screening data. Are there particular trends in this screening data that you'd like to highlight and shine a light on for today's policymakers and school district leaders who are tuning in?
Well, I think there are a couple of things that are really important to understand that are highlighted in some of the data in those infographics and fact sheets that you mentioned. The first thing is the severity of the issue. So one fact that really stuck out to me that sort of highlights how severe this is that of those ages 11 to 17 who took one of MHA's screens in 2020, 51% of them reported having thoughts of suicide or self-harm more than half or nearly every day of the previous 2 weeks from when they took the screen. And that amounted in the whole year to nearly 160,000 young people. So I just want to reiterate, 160,000 young people felt suicidal or like they were considering self-harm. And that was just in the previous 2 weeks. So that just highlights how severe this is and how young this issue is affecting people. Another thing that's really important to acknowledge with regard to this data is that youth mental health has been getting worse over the last decade. And I know I already said that, but it's important to understand that COVID-19 has definitely exacerbated those issues, but they were troubling trends before, even before a worldwide pandemic. Youth were struggling. And so it's even more important now that COVID-19 has exacerbated those issues to address them, but these aren't things that just popped up suddenly. And then for policymakers and agency leaders, one thing that we highlighted in some of the resources in the report is that only 43% of all young people with a past year major depressive episode received any mental health treatment at all, with even lower percentages, like around 33% for both Black and Latinx youth. And that's a really low percentage of people who need help who are not getting help. And among young people who do receive mental health services, nearly 75% of them receive them at school. So that's why we created this report, is to meet young people where they are in schools, because it's one of the most efficient and equitable ways to meet the mental health needs of the most students, especially those who are falling through the cracks. So Black and Latinx youth, LGBTQ youth, all of these groups have had really troubling trends in the past, and with COVID-19, it's gotten much, much worse. So to have this report, to have these resources, to try to meet these groups of people where they are, and to try to make sure that we can address the mental health needs of all students in schools is really important, and that's why we made it.
Thank you so much, Sid. We know that suicide is the one of the leading killers of young people ages 10 to 24. We know that young Black kids are having the highest increases in the rate of suicide attempts, and that there's additional pressures that perhaps older generations may not understand, in addition to kind of academic performance and fitting in and having some social pressures. There's also this idea that they have to meet all of these benchmarks and be prepared to enter the real world upon graduation, in addition to taking care of family or having caregiving responsibilities. I think young people are feeling especially distressed during this time, and there are ways that schools can meet them. So I think the recommendations in the report to facilitate a state response and hopefully a national strategy is much needed. So thank you. To Mary, research shows that a student's mental health and emotional state due to past trauma can impact academic performance. And the report urges legislators and school district leaders to really transform their thinking about framing educational equity as health equity, or framing health equity as part of educational equity. This was discussed at many of the advisory board committee member meetings that we held to inform the report. Would you discuss any specific recommendations or ideas that you highlighted in the report to help school districts overcome academic underperformance by including a health kind of focus with that?
I think that as we've been talking about, COVID really has impacted students in new ways. And for students of color, not only do we see trauma, like you said, Karen, but also grief. It disproportionately impacted those communities. So we are learning through policymaking and through the data that is being collected after the policies that there is a link between mental flourishing and academic performance, right? That probably seems a bit obvious, but it's not always thought about that way. A lot of times there's just such a focus on those academics, not realizing that if you leave behind the mental health and the health, you're not going to get that academic achievement that you're looking for as educators. So what we found is policies that focus on mental health education, focus on mental health services in schools, can make a difference with respect to access for students, but also with respect to their academic performance. So the research on social emotional learning and mental health education shows an impact on academics. And likewise, bringing the services to the schools also showed in Kansas, where they did a pilot project, they got lots of really strong outcomes, not only in academics, in attendance, and also in how students and families felt about the services. They were really happy to have those services right at the school. And that just emphasizes why it's really important to talk to youth and their families as we evaluate the programs and policies that we're putting forth.
Thank you so much. And it's really helpful that you identified the state of Kansas's program, and that throughout the report you have the appendices C, D, and F, I believe, or C, E, and F, which are state charts that any advocate, family member, or legislator can point to and say, okay, what's in place now? And that's really a theme of the report. Look at what's in place already before you start building a framework for going forward to meet the mental health needs of students through schools. So I think you all have done just a really incredible job of making this report useful for every state, regardless of where a person might reside, as well as making it really comprehensive to inform possibly a national strategy that our, congressional or administrative agency leaders can use to move forward as they're targeting ways to support states. For Ethan and Sid, if you want to hop in, the report highlights the role of students in the policymaking process, and you guys touched on this in your PowerPoint. The report includes video remarks of 3 just incredible young adults: Melanie Zhao of Colorado, Angela Wallace of Massachusetts, and Ben Ballman of Maryland, all who are responsible for catalyzation of tremendous change in their school districts and across their states. Their advocacy led to increased funding for school-based mental health services and mental health professionals. It led to improved school mental health professional to student ratios, as well as a prioritization of healing and trauma-informed programs for students on campus following a crisis or following a loss to suicide. Mary, you really hit on the point that there is a grief process that takes place, following loss, whether it's human loss or other losses that have been experienced during COVID-19. Can you, Ethan, just describe how the report encourages school districts to empower student leadership in the decision-making process, whether it's at the school education board level, the community level, or at the state level?
Yes, of course. I think you actually hit it right on the nail on the head when you mentioned that basically the report consists of a lot of data in terms that community boards, local community, state levels, legislators can look at the report and see all this data and see that youth have actually been like the pioneers to advocate for this type of mental health bills. Melanie, Angela, and Ben, they really put all this work in, and if you see how they really got all these outcomes, the positive results that really resulted in better school mental health. I would also say that it's also imperative that these school districts also look inside themselves and look at, is there anything that can tweak? Is there anything that can fix with their own mental health structure, see how they can empower their students? So really surveying students. Luckily, I remember Ben talking about it. He said he even surveyed his group of students in his district to see how they felt about their mental health and how the school was going and how the school could support them. So it's really, I really believe that if the school districts really support students, then they'll feel like they can actually make change. So yeah.
I think you're 100% right about that. Sydney, you were going to step in too.
Yeah, I was just thinking that I could add that something that Ethan said was that this report has both a lot of data and useful resources for young people to use, and also some success stories, which I think is really helpful to hear about, because sometimes young people feel like, they really want to make change, but they've never seen anybody their age or who looks like them do it. So being able to see those success stories and see the incredible work that's been done by peers is, I think, something that helps build the confidence for young people to continue advocating. And I say this over and over again, but if you want to help young people and you want to know how you can help young people, the best thing that you can do is ask them. And so we definitely tried to do that with this report, but it's really important to keep doing. And that means like building in ways into your school district or at the local legislative level and beyond, as well as within organizations that advocate for this kind of thing, build in ways to hear from as many young people as possible and as many types of young people as possible, so that you're able to get a representative understanding of who you're trying to empower and who you're trying to help and how you can best help them. So yeah, I think between me and Ethan, we have really can't say enough about how important it is to empower youth to make these kinds of changes. And hopefully this report can help with that and help encourage other people to help with that.
Yeah, Sid, I think you and Ethan hit the nail on the head when you said that just ask them. When you're talking about helping a certain particular group of people, I think MHA was actually founded on the belief that, the lived experience and the person that's experiencing a mental health condition must be empowered to be involved in their treatment, in their treatment plan going forward. And other people who have similar experiences can also kind of pitch in. And that's where the importance of peer support and peer work really comes into play. So nothing about us without us. Mary, I wanted to turn it over to you as we kind of circle back a bit towards equity. Studies show that access to treatment for Latinx and other students of color increases significantly when services are delivered through schools. The report recommends the inclusion of culturally and linguistically appropriate services, whether provided through community partnerships with private clinics, or telehealth, or in-person services, or through school-based health centers. Decreasing the ratio of students to professionals is another way to improve access and help students receive treatment in schools. Why is it critical to access health services through school districts? And let's start there. Why is it critical for students to access? And you did kind of answer this already, but if you have any other input, let us know.
Well, Karen, I think it's so important because it goes back to the statistics that Sid cited earlier. When you think about the idea that 1 in 3 students of color are getting services that they need, that is just unacceptable. And so by providing services at school, we knock down those barriers. And anybody out there who's tried to make an appointment for mental health knows about the barriers, right? You got a transportation, you got to make that appointment, you got to find somebody available. It's a lot and it's very difficult. So bringing the services to the schools really decreases those barriers to care and allows somebody to receive it in a community setting, which is also easier for people. There is a lot of concern and sometimes stigma still around mental health, and particularly in communities of color, and concern about, identifying as someone who has a mental health condition. And so having those services be right there at school really helps make everybody understand that this is part of the community, it's part of life. People have all kinds of different conditions, and we need to get help when we're not feeling well. And that's the message that we want to send. And I think school-based mental health helps send that message and reach students who otherwise would not have access to services that they need.
I think you're 100% correct. And, this question that I have for you goes a little bit beyond the scope of the report, but I think might be important to some of the advocates that might be using our resources. What advice do you have for parents or school administrators concerned about labeling more students as having a mental health condition or emotional disturbance or other disability recognized under the Individuals with Disabilities Education Act who might qualify for services through school?
Well, I think that's part of why we recommend mental health education. I think the education part is really important. So everybody understands that these conditions are just like any other healthcare condition. And having that conversation with families, with students is really important. And I think that's why we also call for a comprehensive approach. You can't just educate the students. They live in families. The families have to understand when a student brings something forward, how to respond to that. You have to educate teachers and administrators, school bus folks. And I think that we pointed out the Technical Assistance Center that's operated by our New York affiliate, and you'll hear more about their work. But that allows for training and discussion of everybody who's going to touch that student's life. And I think that's really important if you're going to address these concerns and help everybody understand. These are health conditions, just like any other health condition, and we want people to flourish. So you have to get help when you're not feeling well so you can do your best work, both at school and at home.
And I wanted to close out with a final question that relates to just during the time that we live in, COVID-19. There really is an opportunity that we have, with all of the suffering and loss and trauma that we've experienced, the isolation, the really, the hard times that families have been experiencing over the last year and a half. There also is an opportunity to draw down federal funding that's way at higher levels than we've seen in the past. Some of that is one-time funding, and some of it will be ongoing for years to come. What advice do you have for states and school districts to, ensure this funding is used for meeting the mental health needs of students in schools and for ensuring that there's a kind of a structure in place going forward?
Well, I will just reiterate what Sid said earlier about listening to your youth, about what they need and what they want to see that those resources used for. Melanie Zhao spoke about how she stood up before her school board and talked about how they needed to allocate resources that were coming into that district to more mental health professionals in the schools. So I think it's really important to listen to youth and also to look at some of the resources are not targeted to anything in particular. They're for the schools to really think about where the needs are. We've talked about this data. We've talked about how students are feeling. Need to make sure that where the money is following where students think the need is. And that often is mental health.
Well, we know that there's increased need. We know that there is some increased resources coming down from the federal level, and we know that school districts are hoping to meet youth where they are in a comprehensive way. And we ask, I think through this panel, that policymakers and decision makers really support those school districts. Educator mental health, student mental health, should all be a part of that comprehensive framework, in addition to education, as well as services and supports, including excused absences. Well, I think that wraps up our time here today. It's been really a pleasure to speak with you, Mary, Sydney, and Ethan. Thank you for making the time. We will now turn it over to our next panel. We'll be joined by Dr. Art McCoy, former superintendent of Jennings School District, as well as Dr. Bernadia Johnson, former superintendent of the Minneapolis School District. These two former superintendents will have a conversation with our MHA board member, Amy Kennedy from the Kennedy Forum, who is a former educator as well. And they'll discuss how they really transformed and created great outcomes for their majority Black school districts and ensured policy change that led to increased high school graduation rates, increased academic performance, and decreased rates of dropout and missed days in schools. These are all things that we're all, all school districts are working towards. So I think there's something to learn.